Hi, my name is Angela Daly, and I am Vice Chancellor's Research Fellow at Queensland University of Technology's Faculty of Law. I'm sorry I can't be with you today in person, but I've made this video as a second best option. I am hoping, though, to be available for live questions and comments after the presentation. My expertise is on the regulation of new technologies. I've actually been working on the legal and regulatory issues concerning 3D printing for some years, and last year published this book here on legal and regulatory, on legal and regulatory aspects of 3D printing, which includes some discussion as well of 3D printing in health and medicine and some of the specific challenges that the use of 3D printing in these spheres presents to traditional ways of making, enforcing laws and regulations in this sphere. So in this presentation, I'm going to focus a bit more on specifically law 3D printing in the health and medical sphere and give an overview of some of the issues here. I'm not going to go into anything particularly specific, but I'm happy to answer more specific questions afterwards. So at a very conceptual level, I view some uses of 3D printing in health and medicine, at least, as contributing to a sort of decentralizing tendency that some of these uses, as well as some other emerging technologies, are having in the health and medical sphere. So some of these other technologies would be wearable devices and apps, and things like direct-to-consumer genetic or DNA testing. Uses of 3D printing, which would also potentially fall into this sphere, are the kind of decentralized production of things like prosthetics using quite cheap 3D printers. What I think is common with all of these kind of decentralizing developments is there may not be any medical professional or traditional medical device manufacturer or distributor involved in these technologies, or how they're created and how they're distributed and how they're used. And in some ways, this is a very kind of user-centric and user-empowering sort of scenario where the medical establishment is decentered by the use of these technologies. But I think there are some real concerns about these kind of decentralizing technologies in health and medicine, particularly because they pose challenges to some of the existing legal and regulatory frameworks, which I have argued are constructed around the presence of some part of the medical establishment being present. So either some kind of medical professional or kind of traditional device manufacturer that's aware, for instance, of the regulatory framework in which they should be operating. However, there are other kinds of less decentralized uses of 3D printing in health and medicine, by which I mean either you have traditional medical device manufacturers using 3D printing, or 3D printing is used in hospitals by medical professionals. And this has been used to make other kinds of medical equipment. It's been used in dentistry, used in pharmaceuticals, and of course bioprinting as well. And these are all things so far that are very difficult to do except in kind of highly sort of specialized surroundings. These kinds of uses of 3D printing in health and medicine, I would argue, pose less challenges for law and regulation because they usually have involved medical professionals, medical device manufacturers, research institutions, and so on, and also sometimes in collaboration with 3D printing companies as well. So whether in centralized or decentralized scenarios involving 3D printing in health and medicine, there are certain kind of common areas of law that are affected, or that 3D printing affects in this sector. So of course, kind of intellectual property is very prominent. Intellectual property and 3D printing is a big topic for debate in legal scholarship more generally, so not just in the health and medical sphere, but particularly the kind of effects that 3D printing may have on current notions of intellectual property, the extent to which intellectual property infringement may be facilitated by 3D printing as well, has provoked all sorts of ongoing debates. But these debates are also relevant to the medical and health sphere as well, particularly probably debates around patents over innovations involving 3D printing in some way, or over other innovation or innovative products that can now be made by 3D printing. So issues around infringement there as well. But specifically to the health and medical sphere, we also have a medical device regulation and laws around data and privacy in health spheres that are potentially affected by 3D printing in these centralized and decentralized ways. So also a kind of concurrent development is 3D scanning. One of the kind of initial uses of 3D scanning so far has been to scan people's bodies. So sometimes in the health and medical sphere, but also in the fashion sector as well. That kind of scanning involves creating data about people's bodies. That data may be classed as kind of biometric data, and therefore anyone kind of doing that should be cognizant of the fact there are various laws around privacy and particularly health privacy that may be appropriate and may be involved in these uses. I think kind of overall in terms of the sort of advantages of 3D printing, which should also be taken into account by the legal system and these different areas of law, are that we have kind of the possibility of many kind of new innovations. We have the possibility of personalization as well when it comes to either kind of devices or products. And we also have the possibility of creating cheaper equipment, materials and drugs than existing processes. But there's also various areas of concern. So as I've kind of hinted, compliance with existing laws and regulations is one issue. Some of those laws and regulations, it might be argued, kind of impose kind of bureaucratic red tape, but which some of those laws and regulations actually do have kind of play an important part in ensuring the safety of products and also ensuring things like patients' rights around confidentiality, privacy, and so on. And also, I think one of the areas of concern potentially as well is the lack of the involvement of medical professionals in some 3D printing uses in the health and medical sphere. So I think there are a number of ongoing issues which I'm hoping will kind of set some of, or give you some questions to think about during the sessions today. I think, and not just in the health sphere as well, I think these are kind of questions around 3D printing and law, which permeate the various sectors in which 3D printing is being used. So I think firstly, one important kind of ongoing issue is the extent to which in practice 3D printing truly is disruptive of the existing legal and regulatory frameworks. It may pose various kind of conceptual problems, but to what extent is it disruptive in practice? So there has been a lot of discussion about very widespread use of 3D printing coming in, but actually we don't quite have that widespread use yet, despite the fact cheap 3D printers are affordable for, let's say, most people in developed economies. So that's, I think, one thing to kind of consider and think about. A next thing I think is an ongoing issue here is the extent to which we need to kind of plan in advance to anticipate challenges that 3D printing in health and medicine and also other areas as well may bring to how some of our laws and regulations have been designed. So perhaps around the idea some kind of medical professional might be involved in the administering of medications or certain medical processes or the availability of medical devices, and also the kind of effective enforcement of these laws as well. So to what extent do we need to anticipate certain challenges that 3D printing brings, both to the design of laws and the effective enforcement of these laws? And I think the third kind of issue to think about, or discussion point really, is the extent to which laws and regulations might need to be changed to better reflect this changing technological reality. So, I mean, this is a particularly something which is discussed with regards to intellectual property, but if there is kind of widespread file sharing, for instance, should, for instance, copyright law actually just kind of acknowledge this is happening and change some of its rules around, for instance, the infringement of copyrights? Anyway, I hope I've given you a bit of a brief introduction to some of the issues here that 3D printing brings up, both for law and regulation more generally, but a kind of taster of some of the issues specifically for the health and medical sectors. So I'm very interested to hear some of your thoughts on this as well, and hopefully I'll be able to participate in questions and discussion. Thank you.